Imagine waking up in one morning and not being able to button your shirt. Not because of your age or because of an injury, but because of the medicine that is keeping you alive is slowly stealing the feelings of your hands. Fatma is 52 years old. She started chemotherapy for breast cancer. By her third week, her fingers began to tingle, then burn, and eventually go numb. Everyday tasks she had done her whole life became painful struggles. Fatma is not alone. Every year, over 3 million chemotherapy patients develop neuropathy, and most of them return home with no effective solutions. We built ThermoCare for Fatma and others experiencing the same struggles. Cold therapy is clinically proven to reduce CIPN, which is chemotherapy-induced peripheral neuropathy. It works by cooling the hands, limiting how much neurotoxic drug reaches the peripheral nerve endings. But patients today have only two options, and both fall short. One of them is hospital devices that cost up to $3,000 and they are not practical at home usage. And the other one is gel gloves, which are affordable, but they warm up in 10 to 15 minutes and lose all their temperature control. One extreme is too expensive and the other extreme is ineffective. ThermoCare fills the gap between them. To briefly talk about ThermoCare, it is portable home-use cooling glove built on phase-changing material technology, which is also called PCMs. PCMs absorb heat from the surface of the skin during phase transition at a fixed and stable temperature. There are four things that set ThermoCare apart. First one is duration, up to 40 minutes of stable controlled cooling. The second one is portability, no electricity, no cables like machines, and full of independency. The third one is modularity. Like same device, it adapts for secondary markets like arthritis, sports recovery, and carpal tunnel syndrome. The fourth one is accessibility. It is estimated to be $50 to $60, reusable, and built for home usage. We also integrated thermochromic indicator strips for visual temperature feedback. With that way, patients can visually confirm that they are within the safe therapeutic range. Before physical testing, we began our configuration with Python-based thermal simulations, testing over 180 design combinations with parameters like PCM mass, contact area, and melting points. We selected 5 configurations that maintain therapeutic cooling for over 40 minutes while staying safely above 10 degrees. The results are consistent and robust, which means not dependent on fine-tuning. Our next step is prototyping our 2 strongest configuration candidates, targeting completion by the end of 2026 summer. For clinical testing, we are in early discussions with 3 oncology centers in my local city, Kahramanmaraş. They are Necip Fazıl City Hospital, KSU Medical Faculty Research Hospital, and HG Hospital. Every year, 3 to 4 million chemotherapy patients develop neuropathy, a market growing to 15 million cancer cases by 2040. At around $60 retail and $22 production cost, gross margins exceed 60%, projecting $600,000 in revenue at 10,000 units. For funding, we are targeting TÜBİTAK 2209A and the American Cancer Society grant, followed by angel investment to accelerate market entry. My name is Okan. I'm a senior year high school student from Turkey with a background in chemistry and a prior research on reducing the side effects of the tamoxifen, which is a chemotherapeutic drug of breast cancer. ThermoCare directly grew from that work. Although ThermoCare won't cure the cancer, it will make the fight more livable with a glove that is portable, affordable, and convenient for home use. We are not just designing a product, we are designing a dignity. Thank you for listening.